you so
There
much.
we go.
That is
Okay.
correct.
So, committee members, thoughts? Because this can be a quick meeting and we can take what we have and be done.
I'll just say one of my thoughts overall had been that your work on the DC healthcare workforce partnerships, you all had already done so much work that seemed to align perfectly with this, that it did make it, it felt like the coming up with it was more streamlined. And I also thought, like you were saying, it felt like all 6 groups were essentially saying the same things.
Yeah, I was listening to Tamara. I was like, Tamara, did you just read our first 5 chapters when you gave your report? Yeah, but I do think we were the only group that we did have the wages in there. So I do think that was important. So I do think we did include that piece in there. And then also Greg's group, again, a lot of the more specifics on the specific roles. So yeah, I don't have all the different citations that they talked about, but hopefully DC Health can do some of that work. Claudia, Valerie, anybody else thoughts?
Yeah. Hey, Jackie, sorry.
Oh, you sound under the weather, Claudia.
I have COVID.
Oh, well, sorry about that.
Yeah, well, went for what, 2.5 years, and
yeah. We all had to get our, that's the thing when you go that long and it finally gets you. That's what we all said, like, gosh, we went this long and then it got us.
Yeah.
Well, I hope you feel better. That's the most important thing.
Yeah, I've had worse, cases of flu, I think. So I think I'll be all right. My husband went down to the pharmacy to pick up my medicine, so I'll be okay. But listen, it's a couple of things. I just wonder, like, in terms of the time frames, have we been clear enough in terms of, I know there was a template that said, between 2 and 5 years and, whatever, but, I really do feel like we are, in fact, I just came back, I got COVID at a conference where virtually the only topic of discussion was workforce and what a crisis we're in. And this was, advanced state directors of disability and aging services. So, are we being clear enough in terms of the timing of when we think we need to begin to do these things?
Okay, well, let me see if I can share my screen and we could go through the 5 real quick. Hold on, okay? Let me see if I can do that. Let me see if it lets me share my screen. Am I able? It's not, it won't let me share my screen.
I think we can. 1 second. I'll pull it
okay, up. Okay, let's see. I just hit share and didn't let me do it. Is it okay? Here we go. Is this right? Can you see my screen? Can you see it?
It's on the way. We can
it's
tell.
coming
There
in. Okay.
Now we can.
Okay, so you can see it here. So we have, for the first one, short term, 6 months to 2 years. This is the whole idea around the importance of the agencies really talking to each other, and that we have some real guidance, some real awareness around where the money is, where the programs are, and clear understanding about the roles within the government, and can the city really have some awareness around what that looks like. And within six months to 2 years seems reasonable, you guys think?
Well, I think 2 years is too long, but
well, that's the short, that's just the range they put in the template.
Yeah, I'm more concerned, I think, with the second set of categories where we do talk about committing to livable wages.
Okay, well, let's go through one at a time, and then we get there, we can maybe put some nuanced language in. How about that?
Okay, yeah, I just don't think it's 3 years.
So let's go through one at a time. So if we're okay with this one, then we'll go to the next one. So this is really about the whole, which everybody's going to have this one, which is the whole process around, policies and practices within DC Health to really get themselves more in line with the healthcare workforce of the future, and all the different areas of focus, IT, staffing, the diverse workforce. So all of those areas that we've talked about. So that's what recommendation 2 is about. So 6 months to 2 years is the recommendation. So we see that as short term. And so Claudia, here's where you are, is in the improving opportunities for advancement throughout the care continuum. And this is where we have a number of areas we'd like them to focus in on. And the way, when I was organizing this with everybody's input, I looked at it with just a number of areas where they can focus in on. So wages, workplace culture, a number of other barriers, communication, training, job, raising awareness about job opportunities. So those are those areas. And I guess I guess the question is, looking at all of that, midterm 3 to 5 years for everything. And Claudia, are you suggesting that you want to break that into parts? What are you recommending?
I don't think we have 3 years to wait to address the wage issue. While a lot of these things will be helpful unless we actually address this wage issue. In fact, I just had an email from Ian basically saying what they're getting now in terms of, people applying for their jobs are people who aren't qualified to do the $19 dog walking jobs. And, they're like the people who aren't able to get the teller jobs and so forth. So the quality of the workforce has really been impacted. So I think, and everything that I have read and everybody I've talked to in all the other states that I talked to, and I was with a bunch of states over the last couple of days addressing this issue, getting the wage rate up is absolutely essential. And I just don't think we have 3 years to wait. I think we have to do it quickly.
Yeah, I don't disagree. I think this may be, I'm wondering if, the whole equity implication, and not just looking at it, I'm looking at equity, and saying pay equity is I'm thinking pay is, well, I'm looking at equity as a broad issue of equity, but clearly pay equity is a critical factor in terms of overall equity. You know what I mean? I'm just wondering if we couldn't maybe talk about, and looking at many of the populations that are in these jobs, I'm wondering if that might be a place to kind of make some of those arguments about the urgency around time there, as opposed to just like checking a box.
Well, I mean, I understand the issue around urgency. We've just had legislation that does take 3 years to implement wage increases and is costing $35 million over 3 years to get the wages for these entry-level positions up. We could talk about doing it sooner, but it then has to be funded.
Mm-hmm.
And it needs to be funded, Andy. I mean,
Claudia, it's easier to say from where you sit now than it was from where you sat 3 years ago, isn't it? I mean,
but I've seen other states make.
We don't print money. Compare our wages to other states.
Yes, I understand that, Andy. I also know, like, for example, childcare workers within a year will be making 60 grand in the city because of legislation that was passed to get their wages up. And so this workforce will be even further behind. So I'm just saying, yes, we do have to find the money to fund this. And if we don't, we will not have a workforce. We will not have providers. It's just as simple as that.
Well,
And
I mean, I think, Claudia, I think we were past the legislation, but we're not. I can't imagine any situation where, you know, we could pass the legislation in 2023. But I don't know that we will get those wages up in 23. We can
Right,
pass the
we're going to start
legislation.
working on the 24 budget in another
Yeah.
2 months.
I'm aware of that. I'm aware of that. We're also seeing just a trickle of the ARPA funding coming out at this point. So, you know, I think there's a sense of urgency here that and you know, I'm not gonna argue about this. If you think we can do this in 3 to 5 years and still have workers.
Well, I think the reality is, I think that's what Jackie was getting at, is it says 3 to 5, and maybe there needs to be language in here about some of this has to be at the beginning and some of it at the end, because you can't move this whole section up to 6 months to 2 years. There's also a reality about how much you can get done in any given period of time, you know? Like,
Carly, I don't think we disagree with you. I mean, I think we all agree there's a sense of urgency. And so what I'm suggesting is, if there's this idea of like the practicality of when it can happen, but do those kind of do those serve cross purposes of saying, you know, so I guess what I'm saying, do you think we undercut ourselves by being being realistic? Because we realistically know it's not going to happen in a year. And I guess I feel like it is important to reinforce the sense of urgency that we are in a crisis. In your world, we're in a crisis. In my world, we're in a crisis. It's no doubt we're in a crisis. But I don't know if it's going to be possible to do it in the short term. We could put it down, but I'd welcome you giving me a scenario where you see it happening in 6 months to 2 years.
Well, I mean, I know we are and have been talking to council members about this. And yeah, there's the political reality, but the fact is, if we don't flag that it is a priority to increase wages and to do it more quickly, then I think we just need to say this has to be done as quickly as possible.
No, and I think we're all on the same page there. I think we're all on the same page there. And and I'm certainly open if you want to frame up some language that you think to add to that section. I'm certainly open to working that in. And if you think that I was thinking just really reinforcing it as an equity issue. If you think or any of the other committee members think it's someplace else that we can place that, I think we're all open to putting it in there. But I certainly don't disagree.
Why don't we, I mean, can we put the wage issue under short term and just say, I mean, have two different, I mean, not every recommendation in that section is 3 to 5 years, right?
Yeah.
So maybe we just say, prioritize that the wage issue and removing entry point barriers needs to be done more quickly.
Could you do that in the top background section, Jackie, where we talk a little bit about pay equity, where you say, sort of, although this is 3 to 5 years, this issue needs to be addressed sooner rather than later, blah, 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 like put the language there.
Which page are you on, Gail? Where? I'm moving the
right at the bottom of where you are now. Let's see, when thinking about career advancement, the background at the bottom of that page, because we talk about establishing pay equity in these roles is essential. so we talk about this idea of the criticality in that background section at the bottom of the page on the left here, about the criticality of addressing pay and pay equity. Can we put there in that paragraph the concept that Claudia is talking about, and that, we've noted above, overall, this section is 3 to 5 years. However, the criticality of this is that it needs to be addressed on the front end and sooner rather than later, ideally within X number of years. Can we give a nod to it there?
Yeah.
And then living
I'm
wages
sure.
still lives here, but we're connecting it to that idea of pay equity and giving and outright stating what Claudia is saying, which is we've got to figure out how to deal with this sooner rather than later. It can't be on the tail end of the 3 to 5 years. It's got to be up front.
Yeah, and we can block both boxes.
I was
At the
going to
top,
say,
too.
can you check
We can block both.
boxes
We can block
and
both
put-
boxes at the top. We can block both boxes at the top, and yeah, we can block both boxes at the top. That's not.
And then it's the
that's
first
not a
thing
problem.
listed here, and it has to, in to some
Yeah.
degree, not that this is an order, but committing, to livable wages is the first thing we feel it needs to be addressed. What if we did it that way?
Yeah, I think that's fine.
That makes sense to me.
Yeah. So Claudia, I know you probably have that written somewhere in one of your existing documents. And if you want to just forward that over, and we can just plop, not plop, but you know what I mean? We can incorporate that into this document. I do think we need to punch up the equity part in here too, because really the equity implications for this whole section really is about, to me, looking at better opportunities, looking at better wages, better communication, better sensitivity. Those are all critical elements of creating a more equitable environment for folks. I just don't know what the expectations are for the department. We didn't get the resources from the department for professional assistance, and so I was hoping that we would get the resources from the department and that those folks could do some of that work. Like I said, right now I just don't have the bandwidth to do it. So unless somebody wants to take it on, I'll go ahead and submit it, and we'll see if they can add some meat to the bones.
Jackie, I really do feel crappy, but we have written a lot about this. So what I can do is kind of take this document and do a little tweaking with some red lines, and then I'll send it to you. Does that make sense?
I mean, you can. I really wasn't trying to put more on you. If that's something again, Claudia, I appreciate it. That wasn't really, I wasn't trying to do that. I mean, I appreciate it, but
that's okay. No, I mean, I could do that much. It's not, I mean, I think the idea of checking both boxes and just being clear that some of this has to happen sooner rather than later. And I understand how difficult it is from the budget point of view, but I'm not naive about that, but it's where we have to put our heads together and try to figure this out.
Yeah, I mean, and at the end of the day, I think we're a lot further along than a lot of other spaces. So any other comments on that section? So we'll do the same thing there that looking down pretty much did a little bit of the same thing in the apprenticeship space. So we'll do both boxes with those clarifications. Okay. Now we're going to move down to recommendation 4. We probably need to polish up the language, but I guess we're okay with it. Do we want to? I know Ms. Jenkins is very much interested in this. Do we want to think about any elaborate on the language, or keeping it like it is as for the recommendation? Do we want to say something like encourage healthcare employers to create certified apprenticeship programs? because that's really what this is mostly about.
Right. And it seems like the short-term things are related to some of the short-term in the first recommendation. So one would hope, you know, in terms of looking at some of the regulatory requirements.
Mm-hmm.
By the way, I just at this conference learned Colorado reduced their age to 16. So, yeah, I know.
So I think this one is pretty straightforward. Any comments on this one in terms of the I guess we probably do need some background on it, though. We don't have the background. We do have go ahead.
Jackie, hey, this is Paul. How are you?
Yeah, I can't
How's
see
everybody?
anybody, so there, because
Oh,
with my
okay.
shared screen, there you are. Okay. Hey, Paul.
You know, just the term apprenticeship, especially when I'm just really referring to the healthcare space. We don't really create or really have, for that matter, apprenticeship programs. And I know when most of us in healthcare hear that term apprenticeship, we're thinking more along the trades, whether it's plumbing and HVAC and things like that. Whereas most of those roles, we either have people who come to us experienced or we utilize vendors. So I'm thinking maybe along the lines of if we say something around certified apprentice, either create and or expand apprenticeships and or internship opportunities. Because I think with internship opportunities, especially if we're looking at someone in a high school program, that might be something that we can really, you know, structure and get behind in some areas, whether it, you know, like a, you know, I'll say medical assistant or MOA or something like that through an internship program as opposed to a certified apprenticeship program.
Wasn't this partly based, though, on they recently did establish an apprenticeship program?
Yes.
At
They
one
being-
of the,
Yes, there is a Tina Sandry and up at Forest Hills has an apprenticeship program for CNAs that offers a couple of different sort of certifications. I think one is maybe dementia care, one is leadership. I can't remember. But I also just, and hopefully we'll get approval next week, working in conjunction with the Rodham Institute at the George Washington Medical School of Medicine and Health Sciences. We have a proposal pending for a registered apprenticeship program to take people into CNA training and then also get them trained as medication aides. And the thing that about the apprenticeship program is that it requires employer participation, and it is based on an on-the-job training model, which is a little bit in conflict with the way the Board of Nursing sees you need to be trained. But I think we've worked out a way to align those requirements. But the thing about a registered apprenticeship program is that there are certain requirements around it, including offering progressive wage scale. And we think by doing that and getting employer buy-in will actually help attract people into these jobs, and you know, move them along the continuum a bit. Also, being a registered apprenticeship program, there's a lot of workforce development funding. I don't want to say a lot, but there are workforce development grant funding that is only available to programs that are registered with the Department of Employment Services or the Department of Labor, U.S. Department of Labor. So it's a way of also trying to sort of garner additional resources to support workforce development. So I
So,
agree
Paul,
with you. It's not
and-
something we normally do, but we're trying to find trying to find creative ways to get folks trained and interested in these jobs.
No, I totally understand that. And I'll just speak specifically to my organization that even with additional funds available, I don't know if those funds would be enough that would allow us to create the capacity to develop and manage our own program. And I think this may be one of those areas where there are overlapping programs or duplication of efforts taking place around the city. And I mention this because right now, I'm in the process of renewing a contract that we have with some who actually has programs like this, but we're not going to run the program. They're going to run the program. We're just going to provide externships and clinical rotations so that when they're finished the program, they'll be suitable for hire. And that's something we could manage. But again, to me, this is sort of a similar program that is taking place across the city. And I get calls all the time, whether it's some or a program called City Works and other programs around the city, that we're all doing the same thing or trying to do the same thing. And it's a lot of duplication.
Yeah.
Well, it's actually not, Paul, because what some is they're not training CNAs or home health aides, nor is City Works. In fact, because I've talked with City Works at length. And what we've done for exactly the reasons that you have pointed out is the Rodham Institute will run the program with funding that we've raised privately and other hopefully funding that we'll be able to raise for exactly the same reason. Individual employers do not have the bandwidth or capacity to run an apprenticeship program. And but right now I've got, I think, commitments from 10 employers in the long-term care space to participate. And again, they won't be doing this individually. The Rodham Institute will be responsible for all the administrative, all the administrative requirements. But it will ultimately lead to the ability of people to take the Board of Nursing exam and become certified. But to my knowledge, that does not exist. There's no apprenticeship program for people to become trained as CNAs or medication aides. That has not happened yet.
So, to answer, Paul, to your question, because we have been approached by Department of Employment Services to kind of explore, and I do actually have a couple of hospitals who are interested in setting up some apprenticeship programs. So to your point, some folks may be interested in doing this, some may be interested in partnering. And again, when we put this up, again, it wasn't just focused on just hospitals, so primary care, acute care, post-acute, specialty care. So the idea that employers across the spectrum could look at, training programs as appropriate. But I hear you in terms of, wanting to make sure that it doesn't appear that somebody was either locked in or locked out of a particular strategy and any perceptions around that. So what would your recommendation be on the language so that gives the flexibility to that employer that they could opt into the strategy that best fits their model?
I would simply, in the recommendation, and or expand certified apprenticeship or internship programs.
Okay, because we
And
speak to internship programs in there. Yeah, because I know, for example, Howard is very interested in doing the certified apprenticeship program. So it just depends on what works best for your organization. Is that the language? Did I get it right?
From my perspective, yes.
So that's a little all-inclusive. So it gives
Mhm.
folks the opportunity to do both. Is the group comfortable with that language?
Yeah.
Yeah.
Okay, great. I think we just need to, and we may have some language. We'll have to check to see if we have some language kind of on the background of why these programs are valuable and important. So I'll have to look to see if we already have some language as part of some of the work we've already done that might help fill that in. Or Andrew, I don't know if you have anything, just so we can fill in the background section, because that part is missing from that recommendation. Okay, any other comments there? We got the other part to fill in there. And again, we'll send this back out, and any parts that people want to add, please do. Then the last one we have is the adopt competency-based training certification as an essential pathway to advancing careers in healthcare. So I think this is laid out. Everyone agree, and I know that may not be enough time on this one. It says 6 months to 2 years. I don't know if that's enough time, or you think we need more time on that one. Is that a midterm or a short term?
That feels to me more midterm, doesn't it?
Yeah, me
It
too.
feels like
I don't know. I think that might not be enough time on that one. Going the opposite of Claudia's recommendation on that one, I think that one might maybe need more time. Just because if we want to, all the things that we're laying out here that we think is important for these programs, it's going to take a little bit of time. Particularly making sure that the credentialing or certificates are accepted by the board, and that, particularly trying to make it sure that it counts. So there's a bunch of information there. If people haven't read it over, they can read it over, see if there's anything missing, anything you want to add. And I guess that's my ask of this group, that we use this next week or so to really, really, really look these over, make any edits, any additions to this. I want this to be a document that everybody feels that they have weighed in on. I know we've had vacations and things like that. This committee has moved pretty quickly. And so, before this gets put forward, I want to make sure, again, everybody has had an opportunity to provide input. So again, these are the 5 recommendations. Been tweaked a little bit. Appreciate the feedback we've received thus far, and would ask that over the next week or so, you take the time to take a look where you see blanks and where you have an opportunity to provide some input. Would encourage you to do so. And with that, I will pause. Yes, ma'am.
What is the exact date by which you need feedback? That's always helpful for me to.
Yeah, I was just getting ready to go to that. Let me take the screen down, because I can't. It's always hard when I can't see you guys. Let me see if I can. Brenda, did you take it up for me, or did I do it myself? How do I stop the share on this thing?
It's in the same place up at the top right next to where it says leave. It should have like an X through share that you can click. You click the same button.
Yeah, this is yeah, my screen doesn't look the same. Yeah, does it see how my screen looks really funky up here? And then it look kind of crazy. Yeah, see, that's what. Yeah, because normally you see the share button, but it's not on here.
That's not okay. Let's
You see if I do this.
expand there.
Yeah, so see, he disappeared.
Click these dots.
You see, he disappeared. It's just the craziest.
This is really different.
It is different. It's not like our system.
Let me see.
I might wind up getting rid of them all, huh? Yeah. I bet they can see us. We can't even see you guys anymore. Hope I'm not. Okay, let's see. Where are they?
I think we're seeing your calendar.
Here it is back here.
This is it.
This one. Mhm.
Oh, no,
No,
they don't want to
okay,
see
close
that.
Mhm.
Jack, you don't know what you're pulling up. Be careful.
Okay, so there's.
Oh, I don't have anything personal, no worries. I can't minimize it. Okay, here we go. They're here somewhere.
Click down here on this T, right? Let's click in there.
This is funny. There they are.
Mhm. Okay, stop sharing.
There they are.
Okay.
Wow.
Okay. So anyway, looking at the calendar, the final meeting is August the 24th.
No, there's one more. The final meeting is September.
No, but the meeting
Oh.
they want to vote on the recommendations is August the 24th.
Okay, okay.
So let's back in from there, guys. So today is August the 17th, so that's 1 week from today. So would the 22nd Monday work?
Yeah, that's fine.
Okay, so would Monday work? And hi, Dr. Bass, I haven't seen you. Hey. So if Monday I could get your feedback, your thoughts on what we have so far, your comments. And as I said before, what we think is missing would be really helpful to me, so that we really are. I mean, like I said, I feel like we have the recommendations. I feel like what we're submitting is within the scope of what's been asked of us. What I do feel like is missing is some of that extra stuff, some of the background, some of the equity statements. I'm not going to get caught up in the a lot of the costs, because we're not going to know a lot of that. But my team and I can look at some of the legislative pieces, but some of the background, some of the equity implications. If you guys have thoughts on that background, some of the timelines, that would be really helpful to me. And of course, and Dr. Bass, I know you had a lot of thoughts on the competency-based space. If you have any thoughts on some of that apprenticeship, that will be really, really helpful, because I think we have I appreciate the feedback so far. So I actually think we have a good corpus of what we have. Just now we're at a place, just need to polish it up a little bit. What do you guys think?
Sounds good.
Okay, so if I could get it from you all by the 22nd, and the reason I'm giving that long period of time, because I know you guys are going to send me such great stuff. All I'm going to have to do is do the little spell check and turn it in. Right? Great. Anybody who hasn't had a chance to speak up, any thoughts? Okay, I can't.
No, I don't
Okay,
have
well, hearing none, it is always a pleasure to give back 15 minutes on a meeting, because time is so important. I don't see Dr. Strudwick, so and lastly, like I said, if they're we won't. If we get the information back, I don't think we'll need to reconvene. The only reason we'll need to reconvene is if they come back to us and say, okay, Jackie, you guys have 5 recommendations. And Dr. Bass and Andrew and I have votes on the committee. But if they come back and say to us, you guys have to pick, we can do this one or two ways. The 3 of us can do it, or we can reconvene the group. I think that's really the last question. And what's your pleasure? You want the 3 of us to make the recommendation, or do you guys want us to reconvene?
I would rather reconvene.
I would like
I
to-
will, okay, whatever you want is, I'm good with whatever you want. Okay, but I just figured I would ask.
Although that
So-
was just Dr. Bass and I who are saying we'd like everyone else to meet as well, so.
Oh, yeah, I mean, I'm comfortable, but I just figured I would ask.
Well,
Yeah, if,
I'm
yeah.
kind of
So
laughing,
we will-
Jackie.
What'd you say?
I'm sort of laughing because, yeah, well, never mind. No, I agree. Probably makes sense to reconvene if they come back with something like that.
Well, no, they are going to narrow it down. We know they're going to narrow it down. So they are going to, we might get lucky and they take all 5 of ours. It would be wonderful if they do, but it would be surprised. So they may, when we had the mayor's commission last time, they did ask the committees to pick. So in the event that they do, we'll just reconvene. Okay?
Great.
So with that, thank you guys very much. I'll ask Brenda to just send out a quick reminder about the 22nd. We'll send, we didn't really make many changes here, but we'll make that notation, get that out. And thank you guys so much. Claudia, I hope you feel better soon.
Thank you.
And thank you so much for your contributions, and look forward to speaking with you all very, 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 very soon.
Okay, thank
Great.
you.
All right.
Thank
Bye,
you.
everybody.
Thank you.
Thanks,
Bye.
guys.
Thank you.